Hello, I'm Sandra Hurst, and this is the Healthcare Regulatory and Advocacy Organizations Centers for Medicare and Medicaid Services presentation. The CMS became law by President Lyndon Johnson in 1965. It is a part of the Department of Health and Human Services. It was originally known as Medicare Parts A and B in 1965. Medicare Part C was established in 1997, and Medicare Part D was established in 2003. CMS's components. Medicare Part A is for inpatient hospital coverage. Medicare Part B is for medical insurance coverage. Medicare Part C is for supplemental private insurance coverage, and Medicare Part D is for prescription drug coverage. The Children's Health Insurance Program, known as CHIP, is also a part of CMS that was founded in 1997. The purpose of CMS. The purpose of CMS is that it provides assistance to low-income families, provides assistance to pregnant women with low income, provides assistance to people of all ages with disabilities, provides assistance to people who need long-term care, provides assistance to people 65 years and older, and it decreases healthcare costs and utilization. CMS's contribution to healthcare quality and impacts on resource utilization. CMS is protecting health and well-being of millions of Americans. It is saving lives and improving economic security for the nation, increasing access to quality and affordable health care. Proceeding on to the next slide, it creates smarter, healthier system to continue as standard provider for health care coverage. It also improves quality and innovation for America's health care. The last slide for CMS's contribution to healthcare quality and impacts on resource utilization is that CMS Innovation Center improves patient care, reduces costs, and aligns payments for improved patient-centered care, and rewards healthcare providers who deliver high-quality, cost-efficient care. Examples of CMS's contributions to healthcare quality are at least 90% of all CMS's value service payments would be based on quality/value care by 2018. It reimburses providers for millions of eligible Americans. It eliminated out-of-pocket costs of preventative services. The main contribution of CMS's healthcare quality is value-based purchasing, which focuses on quality rather than quantity of healthcare provided. It provides meaningful patient outcomes. It is improving population health by placing more focus on the community, and it provides lifestyle coaches at community-based settings. How requirements and programs improve healthcare delivery. As of 2018, CMS no longer based volume of services delivered, but on delivery model. Developed focused payment strategies shifted from fee-for-services to value-based care, and engaged in various functions to improve prevention by not only treating chronic diseases. CMS has so many programs and agencies that will require at least a 2-hour or more long presentation to discuss them all. Therefore, the two major programs that focus on the two major chronic diseases that kills so many Americans will be discussed. Cardiovascular disease, the leading cause of death in the United States, affects 1 in 3 people and costs the national healthcare system $315 billion annually. And that's according to the American Heart Association, as cited in Bird et al. 2017. Million Hearts Model Program. It decreases community-wide 10-year risks of stroke and myocardial infarction. It uses the American College of Cardiology / American Heart Association longitudinal atherosclerotic cardiovascular disease risk calculator to calculate the 10-year risk score for MI or stroke. And physicians are compensated by tiered incentives based on population decreased risk levels. The Medicare Diabetes Prevention Program. It is a branch of the CDC partnered by CMS that was established in 2018 as an evidence-based clinical trial study. It focuses on maintained weight loss at or greater than 5% within a 12-month period. It also focuses on populations rather than individuals. It recruits lifestyle coaches for preventative type 2 diabetes care. And pre-diabetic seniors have access to this program without any out-of-pocket expenses. CMS's impact on healthcare costs. Value-based care reduces costs of healthcare and duplication. Value-based payments improve effectiveness of healthcare spending. And physicians follow payers' protocols designed to decrease unnecessary healthcare costs. This is the link for CMS's 7 manuals. Each manual has its chapters 1 through 7. It describes CMS's coverages and eligibility requirements. It covers everything you need to know about CMS. CMS's issues of healthcare cost containment. The United States has the highest healthcare costs in the world without CMS's involvement to reduce healthcare expenditures due to a profit-driven nation. Patients continue to be dissatisfied with quality and cost of care. Stakeholders have various profit streams that influence increased costs of healthcare. The examples of these stakeholders are pharmaceutical companies and private insurance companies. Continuing discussion on CMS's issues of healthcare cost containment. CMS does not weigh issues of financially distressed hospitals with low quality care versus financially stable hospitals with high quality care. And CMS's value-based payment offers direct return on investment for improved outcomes, but anticipates that All facilities have baseline financial resources to invest in quality improvement. Conclusion. CMS was founded in 1965 to assist low-income Americans and senior citizens, originally known as Medicare and Medicaid. It is considered a large entity with many subclassifications of insurance coverages known as Medicare Parts A through D and CHIP. And the issues with CMS is evaluating financially challenged hospitals, low care quality that create bias for value-based payments. To learn more about the two major programs that was discussed in this presentation, you can visit the evaluation of both of the programs on the links provided and learn more about CMS's other programs. These are just additional external links that are not limited to this presentation. I highly encourage you to visit these links that could be helpful to you, your family, and your patients. That could be used for informational or educational purposes. The attached document can be either double-clicked or right-clicked to open it. This document was attached just in case that this annual update will not be available for years to come. This is only a guide for the 2021 poverty line guidelines. And this is the end of the presentation, and thank you for listening.